Hello and welcome. Please come in and sit down. How are you doing? Yeah, it's a little wet out there, huh? Yeah, we really need the rain though, don't we? It's been pretty dry this whole season, huh? Yeah. So let's do some introductions, shall we? Would you mind just confirming your name and date of birth for me? Okay. All right, and is that your preferred name, and how do you like to be addressed? Okay. Okay, wonderful. So, my name is Calliope. I am a doctor of osteopathy, and today we're seeing you about some neck pain. Is that right? Okay, in addition to some other things? All right. Just going to note that down there. So, first off, I want to answer any questions you have about me as a practitioner and anything you're looking for in this particular session, okay? So yeah, I am actually a medical doctor, studied with an osteopathic medical school, so I have all the same credentials as a regular medical doctor, like a normal physician does, and then I also have some extra training. So with osteopathy, we're really looking at the body not just as treating one problem and then letting you go. What we're doing is we're looking at a problem and seeing how it may correspond to other problems you may have or what it could be affecting in the body. So we're taking more of a holistic approach. And we really want to look for what we call somatic dysfunctions, right? Or problems in the body, how they're manifesting, how they may relate to other symptoms. And we'll be examining you, not just you sitting down here. We'll take a look at how your body looks when you're standing, when you're walking. How does it look when you're moving from side to side? It's very comprehensive as opposed to just traditional medicine, if you will. So we really want to get a very comprehensive look about what this pain, in your instance, is doing to your body, how it's restricting you, and how we can help you. Okay? So it's a little different from, say, chiropractic. It looks kind of similar on the surface, but chiropractors go to a chiropractic school for their chiropractic training, right? And oftentimes they use a technique called high velocity, low amplitude thrusting, right? That's where you get the cracking. That's when you have the swift movement or the drop tables, right? So osteopathic doctors can also use that same technique, but we have many more to choose from if it fits the situation better. There are over 40 different techniques of osteopathic manipulation, as it's called, and just depending on what your body needs, we'll kind of select what's going to be right for you, and we'll go from there. But we can use some of the same techniques, but it's a little more thorough, if you will. Okay, so that's a little about me and my practice, what we do. So now let's go ahead and talk about you a little bit, okay? What you're here for. So you said you have the neck pain, right? Are you finding that that's really impinging any sort of activity or movement for you? Okay. All right, let's see. Okay, excellent. And what other symptoms are you seeing? Are you finding that you're having any middle back pain, any lower back, headaches, anything of that sort? Okay. Yes, certainly. You can definitely get headaches from really anything in your spine going wrong. See, your body as a whole, it's made up of these individual systems, right? But it all works together to help you live, help you do what you need to do, right? But when something's off, sometimes other things compensate or other things have some dysfunction. It all works together. And especially with the spine, that is a very complex system. So perhaps someone is having pain in their lower back, but they're feeling it translate into their feet, or vice versa. They're having problems with their feet, translates into their back. Some people have problems with their neck, and it translates into they have some facial pain or headaches. So it's all very complex. Yeah. So when we treat those symptoms, that root cause, if you will, sometimes you'll find that those other symptoms start to diminish because they're not being affected by that particular imbalance anymore. All right, so where exactly is the location of that pain? Okay, all right. Okay, and on a scale from 1 to 10, how bad is it currently? With 1 being not painful at all and 10 being the most pain you've ever felt. Okay, so more annoying. Yeah. All right, and when did this start, do you think? You don't have to get super specific, but even, months, years. Okay. All right. Okay, and when is this pain the worst? Okay. All right, and is there any point where it's better, where it's at the best that it can be? Okay. Are there any other symptoms that you have that coincide with this pain that happen at the same time? Okay. All right. And have you found anything that makes it better or worse? For example, rest, or perhaps ice, or a hot pack, or pain medicine, anything of that sort? Any NSAIDs, anything like that? Okay. All right. Very good. And I know we talked about if that made it any better. Is there anything that makes it worse? Okay. Just wanted to confirm that. Okay, very good. So we've got a little picture about what we're going to be looking for. So when we do your examination today, we're going to be doing quite a bit of moving around. I want to see how this pain that you're having affects the rest of your body, if it's making you walk different, if it's making you sit different, if it affects your posture, things like that, because that one problem can cause some other little problems, and we really want to address that, okay? So I'm going to put on some gloves real quick, and from this point onwards, I'm going to need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, that's great. So I'm just going to slip these on real quick, and we're going to have a little look. And then just depending on what we find, then we can do a little treatment and we can talk about where we go from there. All right. There we go. All ready to go. So I want you to please let me know if you have any pain or any discomfort at all, okay? And if I'm moving you around and you feel like you can't move in one certain way or you feel a restriction, I want you to tell me, okay? That's very important. That helps me quite a bit, all right? Okay, so we have you in sitting right now, and I'm just going to look around you. I want you to just relax, sit as you normally do. While I kind of look around you, I might just touch a bit. Okay, so I'm going to just get up here, and I'm just going to have a little look. Okay. So let me see here. Alright, so it does look like right off the bat I can see that your neck is a little forward, right? So our skulls are like a bowling ball, right? And the more that our bowling balls on top of a little stick here, the more that it's forward, it takes so much more force for our bodies to compensate for that. So I can see right offhand that you're kind of hitched a little forward, which will be putting some stress on your neck, okay? So we'll kind of address that. And just taking a little look around. Okay. I just want to see here. Just going to be feeling a bit back here. Okay. All right. So I'm going to go ahead and just go around you real quick, and I'm going to be feeling around the neck. Okay. So I'll be just a moment. Alrighty here, so I'm just going to be feeling around the spine here, and I'm going to be looking for anything off. If anything seems out of place, out of position, if the muscles feel a little off. Just taking a little look and looking at how your neck-back relationship is, how your head is. Okay. Alrighty there. So I'm going to come back around. Alrighty. So now we're going to do a little bit of movement, okay? So I'm going to have you stand up for me. All right? Okay. So tell me a little bit about what's going on right now. How's your neck pain, 1 to 10? How does your body feel? Do you feel off balance at all? Okay. Okay. I'm going to go ahead and come around behind you again, and I'm just going to take a look at your shoulders, your hips, how your spine is, so you'll just feel me feeling around your back. I'll tell you what's going on the whole time. All right? So I'll be right back. Okay, so let's have a little look here. Alrighty. So right off the bat, I can see that you've got one shoulder that's just a little bit higher than the other one, which is pretty common. People generally have a side that they favor. And because of that, your opposite hip is a little higher than the other. So your body's trying to equalize that, but they should be in line with each other. So again, that's a pretty common thing, and that's something that we can work on. I'm just going to be feeling down the spine here. Okay, so your posture itself actually looks pretty good here. So So when you're sitting down, your neck folds forward a bit, but standing up here, you're actually in a pretty good place. So that's good. All right, I'm gonna come back around. Okay, so I'm gonna have you stay standing, and this time I'm going to have you walk, okay? I'm gonna have you walk to the other side of the room and then come back. I'm just gonna watch you while you do it. I'm gonna watch your head, your neck, your back, and make sure that that all looks good, okay? So if you could just take a little walk. Just the other side of the room. And if you could come back. Okay, that looks good. Do you want to go ahead and take a little seat again? All right, I'm just going to take a couple of notes. So it looks like besides the little bit of unevenness in your shoulders and your hips, your posture is relatively good, which is good. And did you feel any impingement, any restriction, any pain when you were walking? Okay, not really. All right. Do you do a lot of sitting down or looking at a computer or looking at your phone? Okay, all right, I can definitely see that. So, unfortunately, with phones these days, we tend to hold them down, right? And that makes our neck crunch down. And we see a lot of that. We see a lot of problems with the neck because of it. But something we can possibly try is when you are sitting down, when you're looking at your phone, looking at a computer, if you need to look down, there's a little joint, a little hinge right in this area. And instead of craning your neck forward, instead we can have you just tilt your head. So instead you'll feel this part get a little tighter, but then you're not doing that, if you will. So I'll show you here. So we're just using this hinge here instead of doing that sort of motion. I know it's a little silly, but that can have a pretty detrimental effect on your neck, on the tiny little stick holding up the bowling ball that is your head. So if we can give that neck a little more support so that it's nice and straight while you're tilted, then that would make a pretty big world of difference, I think. So I mentioned I was going to write some notes. Then we got a little sidetracked, so I'm just going to note that down. Okay. There we go. So what we're going to do now is I am going to have you lie down for me, okay? All right, I'll let you get settled and then we'll do a little bit of testing with your neck vertebrae. Okay, all good? All right, so what I'm gonna do here is I'm gonna hold your head and I'm just gonna be moving it from side to side. And I wanna check each individual vertebra for any impingement, any restriction. We're also going to be checking your atlas axis joint or your AA joint. And I'm just going to have you follow my directions. So I'm just going to turn your head, okay, a little bit here. All right. Okay, is that the farthest we can go? Okay, so now we're going to do that again. Okay, and again. Okay, and let's do that again. And again. Okay, very good. And I'm just going to switch to the other side here. So we're going to turn the other way this time. Like that. Good. So that's already a little looser. Yeah? Okay. And the next. Okay. And the next. And the next. And the next. Okay, so there's definitely some restriction in your right side, right in this area. So what we can do from here is I want to start with a little bit of soft tissue work. So this is akin to like a deep tissue massage. Essentially what we're doing is we're warming up and relaxing those muscles so that they're a little easier to manipulate, they're a little more pliable, and we can work with them to ease that restriction, okay? So I'm just going to be just working with the neck here. And this may be a bit firm, but we're working on relaxing those muscles. Please let me know if it's painful at all, okay? Okay. Just working in those tight muscles and allowing them to relax. There we go. Very good. So now I'm just going to do a little bit of holding here. So this part is a little more along the myofascial release approach. Myofascial release is a very important technique in osteopathic manipulative medicine, and technically soft tissue work also follows that same category, but we've given it a category all itself. But working with that muscle, pressing into it, and letting it release on its own is very important. I'm going to sit here until those muscles give and they allow us to move forward, okay? Okay, very good. All right. So now we're going to move into what we call muscle energy work. And we're using your own muscles, we're working with your own muscles to relieve that restriction. What I'm going to be doing is, since you have this side seems to be the most problem, we're going to start with that one. So I'm going to have you turn your head, and I'm going to be supporting you. And then I'm going to put one hand around your head so that you won't be able to move it very much. And then I'll have you push against that hand. And we're isolating those contractions there. We'll hold that for about 5 seconds. And then, in theory, when you release, that muscle should release just a little bit more so that you get just a little bit more movement in that area, okay? And we'll keep on working with that. We'll recheck to see where we're at with restriction, and we will probably have to do the same thing on the other side. So we're using the body to heal itself, essentially, just with a little bit of direction. Okay, so I'm going to have you turn your head to this side here. Okay, There we go. And I'm just going to support your head here. And so we've got you drop down, and I'm going to have you turn to the other side. So you're turned to the right here, but I want you to try to turn your head towards the left. Okay? All right, so try to turn your head. You won't be able to get very far. We're going to hold that. Okay? Very good. Good. Okay, go ahead and release. Let your head just drop down a bit. Okay, so you get just a little bit more movement. We're going to do that again. So I'm going to have you go ahead and turn your head to the left. And hold that position. Keep that muscle constricted. And go ahead and release. Okay, it drops down just a little bit more. We're going to go ahead and do that one more time. So go ahead and just push into my hand to the left. There you go. Very good. And we're going to hold that. 1, 2, 3, 4, 5. And release. Okay, so you have quite a bit more movement right there. So that's good. We're going to go ahead and recheck you then and see if that made you get a little restriction on the other side since we stretched the one out. Okay. So I'm just going to turn your head one side. There we go. And again. And again. And again. And again. Very good. Okay. And then the other side here. Just isolating each vertebra, each area to check. Side. Okay. Bend to the side. Bend to the side. Bend to the side. Lastly, bend to the side. Okay, good. So there is a little bit of restriction there, but not as much as we had on the other side. So we're going to work with that other side. So now if you'd like to go ahead and drop your head to the other side, so that'd be your left. And I'm going to support your head, and then I'm going to have one hand on top of your head, keep you from going anywhere. Now I want you to turn into that hand, so go ahead and turn to the right. Okay, and hold that for 5 seconds. 1, 2, 3, 4, 5, and release. Okay, very good. Let's do that again. So turn your head to the left. Okay, and hold that. 1, 2, 3, 4, 5, and release. Okay, we'll do that just one more time. All right. Go ahead and turn your head to the right. Okay, and hold that. 1, 2, 3, 4, 5, and release. Okay, so you get a little bit more movement there. So now we're going to do one little final check, okay? So what I'm going to have you do is just let me move your head around just like the last couple times. So we're going to check this side. Okay. 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 Perfect. And the other side. Okay. 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 Very good. Okay, so that looks much, much better than when you came in. So I'm going to let you go ahead and sit up for me. Okay, very good. Alrighty. So let's go ahead and talk about where we go from here. So oftentimes, like one would see a chiropractor, when you're addressing an issue, you may see them once a week, twice a week, for a certain amount of weeks until we see a really good amount of improvement. And then we do little maintenance sessions afterwards, maybe once or twice a month or every 1 to 2 months. Okay? So I think with what we're dealing with here, we can either do once or twice a week, just depending on what works for you. I would prefer to do twice a week, but some people, it's a little tough to do that. And we'll start with 3 to 4 weeks. If you go with once a week, we may have to extend that to 5 or 6, okay? Just depending on how much improvement we see, okay? So I'll let you think about that, and you can make your appointment and chat about that with the receptionist after we're done here. In the meantime, I have an exercise that I want you to do. Okay, so now we're getting into physical therapy, essentially. So what I'm going to have you do is you can do this sitting or lying down, but what we want to do is really stretch out these muscles here, and that'll help make them a little more pliable. So I'm going to have you, I'll just move back a little bit more so you can see. So we don't want your shoulders to come up at all. We're going to keep your shoulders down, and you're going to reach one arm forward, okay, without moving it up, just across, while the other arm comes back, okay? So you'll be able to feel a stretch right along here, okay? And then so you'll go from one side and very slowly go to the other side, okay? So you don't have to reach out as far as possible. Just a few feet in front of you will do, okay? And we want to make sure we're doing this slowly, okay? We want to really work with the muscle. We don't want to, go super quick and end up straining it or damaging it, all right? So just real slow. Back and forth, okay? You're not twisting your whole body. You're just working with those muscles there. Back and forth, okay? Would you mind if I see you doing them? Okay, just like that. Real slow. Back and forth. Okay, good. So I want you to do those about 4 to 5 sets of them, okay? So it would be 1, 2, so on and so forth, about 4 or 5 times a day. Again, you can do this whether you're sitting or whether you're standing up. And by the next time I see you, we should hopefully see a little bit of improvement. But we really want to get your strength up in those areas, okay? All right, so just going to note that down, that that's the exercise that we're working with currently. We may add more to the mix the more we work with you, but just for now, that's what we want to start with, okay? All right, so finally, do you have any questions for me at all? Anything that you're concerned about? Okay, that's fine. If you have any questions for me, you're more than welcome to call the office, all right? And I can have either myself or a nurse get back to you, all right? Yeah, so I think that this will work really well for you. There's definitely some dysfunction going on there, and I think this will be an excellent treatment for you. I think we'll see a lot of improvement with it. Hopefully we'll reduce a lot of that pain. I know it may be, a bit of a long shot to say that we'll cure it, but if we can really reduce that and if we can eliminate it, that would be excellent. But we'll keep working with you so that we can reduce that pain and reduce the restriction, all right? Okay, so thank you so much for coming into my office today. I really appreciate meeting you. I hope you have a whale of a day and a good rest of your night. Don't forget to see that receptionist on the way out so you can make your follow-up appointment, okay? All right, I'll see you later. Thank you so much for watching. I really appreciate it. Please like this video if you want to, comment if you'd like to, and subscribe